today's webinar. Our presenter today is Dr. Shiwan Zhang. Dr. Zhang has a strong commitment to empirical research and practice in injury prevention, including traffic injury prevention for vulnerable road users. Her areas of interest include theory-based behavior change and behavioral safety program development and evaluation. Dr. Zhang has been involved in designing safety education materials for children, parents, and teachers funded by Safe Kids Worldwide. Currently, she is working on behavioral safety program development and evaluation for motorcyclists in Florida, funded by the National Traffic Highway Safety Administration. She is also working on the development of a community-based Healthy Buddy program for transportation disadvantaged older adults, funded by the Center for Transportation, Environment, and Community Health. She's taught a variety of public health courses at the University of South Florida and serves as a journal reviewer for several academic journals. Dr. Zhang holds a PhD in public health from USF College of Public Health and undergraduate and graduate degrees in health education. And now, Dr. Zhang, I will hand things off to you.
Thank you, Kristen. Hi, everybody. My name is Siwan again. Currently, as Kristen introduced, I'm with Motorcycle Injury Prevention Team at University of South Florida Center for Urban Transportation Research, Qatar. So today, I'm going to presenting motorcycle safety programs using public health approach. So in this webinar, I'm going to talk about motorcycle crashes in Florida, what public health approach is with several widely used public health theories, and motorcycle safety programs that my team has been doing using public health approaches. Let's check out why motorcycle crashes are a major public health issue in Florida. Florida has the second largest motorcycle population in the states. It should be because of our good weather to ride year-long and popular motorcycle events held in Florida. We have about 610,000 registered motorcycles and about 1.2 million endorsed motorcycle riders in the state. However, in terms of the percentage that motorcycles account for Florida's entire motor vehicles, it only makes up 3% of registered motor vehicles. Also, it is less than 1% of traffic on Florida roadways. This means that motorcyclists are in many fatal crashes, even though there are not that many motorcycles on the road. So what is the actual fatality rate of motorcyclists in Florida? Just think about the numbers I just mentioned, like 3%, 1%. So what about the fatality rate? Would it be like 5%, 7%? Last year, about 17% of traffic fatalities in Florida were motorcyclists, which account for 523 Floridians. So in Florida, motorcycle crashes are apparently one of major public health issues. Now we see that motorcycle crashes is a public health issue in Florida. Then, what is public health and what is public health approaches? Let me show you a great video clip that my boss picked up from President Obama's talk. This will help you understand how transportation safety, including the motorcycle safety, can be related to public health.
Auto fatality rates. The auto fatality rate has actually dropped precipitously, drastically since I was a kid. Why is that? We decided we had seatbelt laws. We decided to have manufacturers put airbags in place. We decided to crack down on drunk driving and texting. We decided to redesign roads so that they were less likely to have a car bank. We studied what is causing this these fatalities using science and data and evidence, and then we slowly treated it like the public health problem it was, and it got reduced.
There we go. I love this video. We will revisit the motor vehicle fatalities rate soon. And here is definitions of public health. According to CDC, the focus of public health is on the health, safety, and well-being of entire populations. Also, one unique aspect of public health is that it does value multidisciplinary approaches. Also, public health professionals, we try to prevent people from getting sick or injured in the first place, promoting their healthy behaviors. You are looking at the 10 leading causes of injury deaths by age group in the United States. The blue cells on the top indicate motor vehicle traffic injuries. As you see, it is number one cause of injury death among ages 5 to 24, and the second leading cause of death for the rest of the age groups. Please see the red line in this graph. As President Obama mentioned in the video clip, the overall motor vehicle fatalities dropped, even though it is still the leading cause of injury death in the States. Okay, the red line shows the decrease from year 2005. However, the motorcycle fatalities, the pink bars, increased since 2000 and did not show any big drop down over the past 15 years. So now we confirm again that motorcycle crashes are a public health issue in Florida, threatening the public's health and safety. And that issue seems to need public health approaches. Yes. Now you might be curious what public health does to solve those public health issues. This figure shows one of widely used public health models when you develop disease or injury prevention interventions. Public health approaches start with defining the problem using scientific data and identify risk factors and protective factors. Based on the findings from the first and the second steps, intervention programs and strategies are developed, implemented, and tested to determine their effectiveness. So once the intervention programs have been proven effective, they must be implemented and adopted more broadly for the public's health and safety. In public health, we emphasize the importance of using behavioral theories because it helps us follow each of the steps more effectively and accurately. Now, let me introduce several widely used public health theories based on the National Cancer Institute's theory at a glance. This book includes main public health theories with easy examples. If you are strongly interested in public health theories by chance, this book is my #1 recommendation. So what is theory? Theory is defined as a systematic way of understanding events or situations. So we use theory to investigate answers to the question why, what, and how health problems should be addressed. Although theory itself is very abstract by nature and does not have any specific content or topic, it provides us understanding of health and the many factors that influence health and health behaviors. So for health behavior practice, theory can be used to guide why people behave in a specific way, what we should know, and what should be done to change human behavior. It means that we can use theories to learn what we need to know before developing, planning, and evaluating intervention programs. So these are some key definitions of theory. The first one, concepts are primary elements of a theory, like it is like the building blocks of a house. The very basic first step. And constructs are core components of a given theory. and variables are operational forms of the constructs that are used in a specific situation. Variables define the way a construct is to be measured in a specific situation. Lastly, models draw on a number of different theories to help understand a particular problem in a certain setting or any context. So the trans theoretical model, TTM, I'm not sure if you have heard of it, but that model is a good example of that model in this slide because it integrated multiple behavior change theories. So oftentimes, public health theories are discussed based on the ecological framework, which is a multi-level and interactive approach. The ecological perspective was derived from general systems theory, which views phenomena as open systems, not closed. So it consists of mutually interacting components in it. So I would just like to mention Bronfenbrenner. He's a father of this ecological framework, which has influenced various social and behavioral science disciplines, including public health. So simply, it consists of 4 levels: microsystem, mesosystem, ectosystem, and macrosystem, which has the culture. I will talk later on about this ecological framework. Let me, just to help your understanding, let me give you an example from the book, the Green Book, Theory at a Glance, to help your understanding about the social ecological perspective. Let's say there is a 20-year-old man who does not exercise. There might be many factors influencing his behavior. He maybe believe that exercise is not important. So that belief accounts for intrapersonal level factor because it is his own belief within himself. If he has no friend or family members to exercise with, the factor falls into the interpersonal level. In terms of community level factor, the on-campus rec center hours does not conducive to the person's school schedule if he's a student at a college. So if a specific social norm exists, like young people don't need to exercise, it could be a community factor preventing his exercise. The last level, public policy, there could be no policies to incentivize exercise, which can support the person's exercise. Alrighty. Based on the ecological framework, the authors of the theory book, the Theory at a Glance, summarized widely used public health theories. I wish I have enough time to go over one by one, but I would just read it over, the main theories names and some key concepts here. It starts with the individual level theories, the health belief model, HBM, and stages of change model. This is originally from trans theoretical model, TTM, and theory of planned behavior, TPB, and precaution adoption process model, which was added in the second edition of the book. And please focus on the self-efficacy construct in the health belief model. And the 5 stages under the stages of change model, which includes pre-contemplation, contemplation, decision, action, and maintenance. I want to share an example that we used to assess motorcyclists' perceptions on their helmet use. We used health belief model, HBM, to design our pre-post survey to measure effectiveness of the mentorship program for every rider, MIPR, which aims to promote riders' voluntary helmet use. Fortunately, we were able to use the full version of HBM, having multiple questions under each of the 6 constructs. For example, when you see here, for the self-efficacy construct, we asked people to assess their own ability for the 5 helmet-related knowledge and behaviors in the slide. To measure the rider's readiness for continuous helmet use, we use the stages of change model of TTM. The question was, how soon do you plan to start consistently wearing a helmet? And the answer options include the 5 stages, from the pre-contemplation stage to the maintenance. So, as you saw, we used both HBM and TTM for the helmet survey, assuming that the riders who are in a specific stage might have unique characteristics regarding the health belief model constructs. For example, the riders in the action stage could have stronger perceived self-efficacy than the riders in contemplation stage. In that case, a tailored intervention that can improve riders' self-efficacy needs to be conducted to lead the riders in the contemplation stage into the action stage. Here are interpersonal level and community level theories. And again, please refer to the book, The Theory at a Glance, for more information. But the interpersonal level, the social cognitive theory is really widely used public health theory, which emphasizes some like interrelationship between the personal factors and environmental factors. And those 3 community level theories, recently we started use these theories to assess, predict, and understand social media use. These are the studies we found out that used some public health theories, the ones I just introduced. So when you look at the table, most of them are about motorcycle safety, and you see a couple of just general transportation safety studies. So when you look at the theories they used, I see health belief model, HBM, and TPB, theory of planned behavior, and TTM, trans theoretical model. These 3 are very popular in this transportation safety research. Now, I just wanted to share with you about the motorcycle safety programs using public health approaches. This is the social ecological model approach. As I just briefly mentioned in the previous slide, it consists of a total of 4 levels from individual to policy level. So in this approach and model, we strongly believe that these 4 levels need to be included when you design or develop safety or injury prevention programs. So if you only have the individual level, like personal education, we don't think that it would just work out. So from the individual level to the policy level, our team has been doing various types of interventions. I'm gonna show you the pictures from here. Oh, before we get into the programs we've done or we are doing, whenever we design our programs based on the public health approaches, content-wise, we refer to this reference, the countermeasures that work. So according to ITSA, motorcycle safety could be improved if we increase helmet use, reduce alcohol, impaired motorcycle riding, increase proper licensing, and promote lifelong learning through the completion of rider training courses. So this from here, I'm going to show you the programs that were conducted at the individual level. So usually our outreach team goes to community events that motorcyclists just get together, and our staff members, they were trained based on our curriculum and the logistics, and they just educate these riders, the tent visitors, one by one. So we say this is just individual level program because we educate these individuals one on one. And this is interpersonal level intervention we have been doing. Mentorship program for every rider. We wanted to pair endorsed riders and BRC rider coaches to promote their safer motorcycle riding. So we believe that that continuous relationship will promote their motorcycle safety behaviors, including their continuous helmet use, given that we do not have the universal helmet law in Florida. This is that MIPR material list. So when we develop this curriculum, all of the MIPR materials, including the lesson plans, handouts, writing skill session videos, everything has been made available on the MIPR website for rider coaches and training school sponsors who are interested in replicating the program. We are still in the process of implementing this research project. So this is the picture of the mentors and mentees and our color team step members. This is the community level program, the Rise Smart Florida. We provide some data, the motorcycle crash data, and make educational materials to distribute. And we do online campaign. This was the Watch for Motorcycle. We did it at the Biketoberfest 2015. So in the community level, we make PSAs to promote motorcycle safety, and this specific one was about motorcycle insurance. We do social marketing campaigns too, which includes both offline and online programs. So we started Mechanics of Riding social marketing campaign. This is the social media channels we launched and we are running now. And we did social marketing offline events with our riders in the community. We do traditional media campaigns as well. So this is the billboard, the Watch for Motorcycle. And this is in the magazine. So Stop Impaired Riding campaign. We visit motorcycle clubs too to meet with the motorcyclists and locate our educational materials in there. We have track day. So we just want to help riders, specifically sports bike riders, to advance their riding level or skills. So they ride in a really protected, safe environment. This is our May's Motorcycle Safety Awareness Month proclamation event we did in the community. So the last level, in the policy level, what we have been doing is we make some materials, including latest motorcycle crash data and all the like safety centered like documents that we want to achieve. We provide this information to our legislators, so we contact one by one. And we just ask them if it is okay if we send this out, then we send it out. If they want like further information from us, we just are providing it. Also, we make our own 300 words policy statements, and we just distribute this to legislators and other stakeholders to promote motorcycle safety in the legislative level. Alrighty, so my presentation is it. If Chrissy, do you wanna take the call? Yep.
Thanks, Siwan. I will get Chrissy on the line, but in a moment, I would just like to kind of remind everybody how to ask a question. And the Q&A box is located in the bottom right-hand corner of your screen. Simply type in any questions and or comments, and we'll be able to ask your questions. And Kristen, are you there?
Yes, I am. I apologize.
That's okay. Go ahead.
Sure. All right. So, first question is, I like the track day, but was wondering how is this operated? And it kind of sounds like a liability issue. Can you talk a little bit more about that?
Actually, I'm not the main person who was in charge of the track day program. But as far as I know, we've got some funding from FDOT to make this track day. Um, we found out that the sports bikers who do the speeding on the road, we thought that if we have that type of track day, it would be a great opportunity for us to have those sports bikers in a like safe environment so that they could just ride as they want. So basically, the funding came from the state government, FDOT, and we just researched it and selected safe track day existing um, places, and we just support some money for the riders to come out and ride.
All right, sounds good. The next question that's come in here is asking, would you be willing to share these motorcycle safety awareness materials for other states to use? Really
Sure.
like the billboard design.
Oh, okay. There is a story behind the billboard. Actually, our team director, Dr. Chen Lee, he just saw that like similar design for the first time. I think it was from like Australia, Canada, I don't know, some like outside country. So he asked them to share the basic like design, and we, under their permission, we were able to modify it and used it. And I think he would be happy to share the design with you.
All right, sounds good. We have your contact information, so we will follow up with you after this webinar.
Yes, ma'am.
Next question coming in, is there a disparity between males and females in the fatalities?
This is data question. I'm not the data person, but as far as I know, more than 90% they are male writers. And that's it, as far as I know. But I could just connect the I don't know who asked that question, but I can connect that person to my team director who does that all the data.
All right, perfect. I'll be sure to connect them after this.
Thank you.
Next question coming in, do you have evidence that your efforts have resulted in lower crash rates?
Haha, that's a very good question. I wish, but actually we do like annual statewide motorcyclist survey, and we are doing some observation surveys too, which we just randomly select the intersections and observe the motorcyclists, basically their gear use. So we are doing that type of evaluation activities, but it, as a researcher, it is really hard to tell our efforts made some difference. But what I can tell you is we have those types of evaluation methods.
All right. Next question here is, do you know how the professional photographer was funded? This is a great idea as well.
Uh, I'm sorry, would you just repeat the question?
Do you know how the professional photographer was funded? This is a great idea.
Mm, I'm not sure. We just used the professional photographers using our resources, our funding.
All
I'm
right,
not sure.
sounds
If you ask me about the way to get them, um, I don't know. When I did my the social marketing offline campaign, I just contacted the professional photographers group after I Googling them, and I contacted them and worked with them to select good photographers who had some experience in motorcycle photos. But other than that, yeah, that's the way I did it.
all right. Now, next question is, how do you reach those hard to reach, quote unquote, freedom riders that will not wear helmets, ride from bar to bar, wear black, those
That's a
types
good
of
question.
riders?
Yep. I can give you an example about sports bikers we are working with. We they are relatively younger and they do not come to the major motorcycle events in Florida. So what we are doing is we are doing social media campaigns to work with them. So based on our research on that population, we just chose to use social media channels to work with them. So when you check out our mechanics of riding social media channels, we target those like younger sports bikers, for example, that it's really hard to meet with them in person, but we just approach them using the social media uh, campaigns. And other than that, we meet with a lot of writers at the events, including the major Florida events, and we go to community events too. So yeah, we meet with them in person, and we use our social media channels to work with them.
All right, great. Do you apply the public health approaches to every motorcycle safety program you do?
Haha, good question. I wish, but it depends. We always want to make sure that we are comprehensive and multi-level enough to maximize the effectiveness of programs, but depending on available resources and timeline, we make decisions in what extent we want to apply the public health approaches. For example, applying the full version of a public health theory, such as the health belief model, in a survey is a sort of demanding, given that people already have survey fatigue and there are other limitations to conduct a lengthy survey. But yeah, we are trying.
Okay, great. How do you feel the peer-to-peer campaigns are working to change behavior and increase skill sets?
I'm not sure about the peer-to-peer one because currently the interpersonal level mentorship program that pairs the rider coaches to BRC graduates. So I'm not sure if I can say they are peers, but that'll be a great like research topic.
All right, great. Just a couple more questions here. When you design intervention programs, do you use more than one theory or can you?
Uh, Yes, as I just showed in the slides, we used HBM and TTM, both of them, even though we did not use the TTM at a like full range level. Um, yep, we do, but you know that it's really hard to have the full versions of each individual theories in a study or program.
All right. Would you recommend a good reference to study public health theories?
The theory at a glance. As I showed you in the slide, if you just type that title then you will see the PDF version. You just simply download it, read it over. That's very good. Like, I would not say beginner's book, but it is pretty much comprehensive, covers all the widely used public health theories with good examples. So you will love it.
All right. Did you try the diffusion of innovation theory and why or why not?
Good question. Yep, we started applying that theory to our I'm not sure if I can share this idea with you at this point, but I'm personally interested in DUI riders' behaviors and perceptions. So I just try to apply that diffusion of innovation theory to that topic, but we've not done anything yet.
All right. Looks like that has taken care of our question. Oh, I'm sorry. Actually, there's a couple more. My apologies. Are the rider coaches paid for the mentorship program or is that voluntary?
They were paid because this research project, it is being funded by NHTSA, and we just wanted to see some voluntary helmet uses happening if we use those like mentorship programs. So under the study, we are paying kind of minimum like um, compensation for the coaches' hours. But our goal is to make it more like voluntary basis community program after the study is done.
Okay. And what is the current level of student participation in the mentor program?
Do you mean the BRC students?
I'm not sure. It only says
It
student
should be,
participation.
I think, yeah, at the end of the BRC, we just hand out, I'm sorry, the flyers to advertise the program. They just voluntarily sign up in our website. Then we just check their schedules and uh, set up meetings based on their schedules. We have at least six riders in A class, and we have the rider coaches who could do the mentoring. So we just match them once the class is set up. That's what we do with the BRC graduates, the students, if you mean that, like BRC student.
All right, great. Another question. Any thought as to why there is no helmet law in Florida or or
I'm
any
sorry.
suggestions for making policy level changes?
Uh, I know there are like a good number of people who are trying to make it happen, the universal helmet law, but I don't know.
That's definitely a question that we get a lot from time to time.
Right. There are a lot of like stories, but I don't think, yeah, I would just say I don't know. But I wish. I really hope that we have that type of like policy level intervention because the evidence is pretty much obvious.
Okay, well, that looks like it wraps it up. This is a very engaging discussion. Thanks for taking all the time to answer these questions.
Sure
If
thing.
you have any additional questions after we log off, just feel free to follow up with us and let us know. Our next webcast will be on September 13th, 2018, the role of public transportation during a state of emergency declaration due to natural disasters, with our presenters there on the screen that you can see. Also, a survey should have popped up on your screen. We would like to encourage you to fill that out. Let us know how we're doing, and hope you enjoyed today's webinar, and we look forward to having you on our future Cutter webcasts.
Thank you, Chrissy.
Thank you, Chrissy. Thank you,
Thank you.
Siwon.
Yep.